This morning, President Biden is ordering the use of FEMA funding to help in COVID testing. It directs the U.S. Department of Health and Human Services to use the funding to create and run testing sites. They'll do it in coordination with state and local public health departments. D.C. correspondent Bofta Yimam joins us live from Washington. And Bofta, the president met with governors yesterday. He was on a call with them. They were vocal, so was he. Give us a chronicling of the call.
You know, Sharon, the main thread coming out of there is really that this is not going to be solved on the federal level. And that is what the president said to the governors. He pressed upon them, local, state leaders, to encourage, continue to lobby your constituents, your people in your state to get vaccinated and to get boosted. He also acknowledged very pointedly that they do not have enough of at-home tests. And that's something that all of us can tell, because if anyone or a friend or a loved one has tried to get a test before visiting any of us during the holidays, that was something that came up. It was the huge thing, and it continues to be. If anyone goes to New York these days, every 4 to 5 blocks, you're going to see new testing sites just popping up. Part of that, what you're seeing even in New York, is FEMA deploying hundreds of ambulances and EMS crews to transport patients. We're seeing ramp up tests, those testing sites. And the president talked about protective equipment even being added to what was the number, and now just increasing that several fold, plus mobilizing 1,000 military doctors and nurses. As we know, hospitals are facing just another hard hit after what they've already been through. And so, you know, when we look at the progress, the president pointed out to the governors that there were no over-the-counter tests in January. And by this month, December 2021, there's been 200 million. In November, there was 100 million. We've got that website that they're looking to launch in January that will help 500 million folks be able to get tests, but how soon you'll get it remains to be seen. Here's what else he had to say to the governors on Monday.
My message to the governor is simple. If you need something, say something. And we're going to have your back in any way we can. Last week, we took steps to bolster support for you with, number one, more capacity to get shots in arms. With more places, more vaccinators, more times for folks to get vaccinated or get a booster shot. And we've added appointments for booster shots, adding hours, getting more convenient to get a booster every day.
Make sure that we do not let federal solutions stand in the way of state solutions. And the production of 500 million rapid tests that will be distributed by the federal government is great. But obviously that dries up the supply chain for the solutions that we might offer as governor.
And right now, of course, as we head into New Year's Eve, if you are looking to get testing done, you want to make sure that you're prepared, that you may have to, depending on what state you live in, be prepared to wait outside potentially, see if you can make an appointment between now and New Year's Eve if you are planning to head out. But as always, we encourage everyone, be safe out there. You know what to do. We've been here before, and it doesn't look like it's letting up anytime soon. And one, statistic that I was reading about, Sharon, that at least for me really popped out was 425 employees have left in the past 2 years nursing home facilities. So we hear a lot about hospitals and the surge that's happening there, but nursing homes, the demand is still there, but they do not have the number of people working. And that's something that's probably going to continue. And we care about our loved ones, the elderly who are going through this with all of us. But it looks like nursing homes, just 58% are offering limited numbers because they just cannot take in more people. And so these are the kinds of statistics that are very scary as we head into 2022. But of course, as you and Naja have mentioned, we are going to keep hope there that things will turn around.
Yeah, and we've heard part of the president's plan that still hasn't gotten through, senior care. That's one of the line items in it. We've all seen the long lines, though, for the testing, Bofta. It's unbearable for some folks. New York, D.C. What is President Biden saying can be done right now?
So he's saying that FEMA is going to really help up with some of those pop-up sites that we've already seen in New York. They were able to put up several sites within 6 days. Folks who are worried about insurance because they, are struggling right now and getting a test, even if it's $25, might be an issue. He's saying that those will be free tests out there if you have no insurance. If you have private insurance, you'll get reimbursed. mobilizing 1,000 military nurses and doctors, getting those folks who would help at hospitals, FEMA to help out more to transport patients. So, out of the behind the scenes things, this may not be the thing that people see right away, though, meaning even if it's 1,000, when you're looking at how big our country is and some of the hot spots, you may not see the changes. But in New York and DC, those are things that we're starting to see now. But by the time, it's all about timing. By the time these at-home tests are in our hands, will we be through the worst wave? And I don't know if anyone can answer that right now.
And what comes after Omicron, And will the website, there's only, starting tomorrow, 3 days left in 2021. Is the website to get the testing kits going to be ready? Bofta, that's the question. Bofta Yimam, you stay safe. Yeah, no, go ahead. Yeah,
I was gonna say,
it's just too much.
The amount of people who are going to be trying to sign up all at the same time to get grandma and grandpa tests and themselves tests and all of those things. A lot of unknowns right now. So I think what anyone can do right now, if you don't have to put yourself in a situation, and you all know what the situations are, we've been through it. Just be safe, be smart, be safe. And if you're trying to get on a flight, good luck to you, because it is a mess. So, we are.
Yeah, and it better be worth it. Better be worth it. You're going to the airport.
Trip, I'm like, but 23, maybe.
Right. They're right, maybe. Okay. You let the baby get born, and we'll have to, you know what I mean? You'll get a whole year of mothering it, and then we'll talk about it, because right now, shelter in place, baby. Bofta Yimam, live in D.C. Thank you so much.